And we are back. I hope everybody had a great weekend, enjoyed some of the nice weather. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. I had to chuckle over the topic tonight because sometimes when we're sitting here planning out topics and thinking about what we're going to do, sometimes it's the obvious ones that escape me. So this is a kind of a question that I get asked all the time and it just rolls off my tongue, and I never actually thought to do a video on it. We've addressed it in several videos. I think I've addressed it in every video we've done that concerns foam rolling. If you haven't seen our videos, just go to our Total Performance Physical Therapy YouTube channel and you'll find all of our videos there, or subscribe to our Facebook page, and then most of them are also there. But I talk about this in all of the foam rolling segments that I do, but I've never specifically addressed it. And so tonight, after I got asked the question enough times, I said this has to be an entire video in and of itself, because it is the main reason people stop foam rolling. I can't tell you how many times I've come in to give a new patient a foam roller or discuss foam rolling with a new patient, and they say, you know what, I already have a foam roller sitting in my closet, it's collecting dust, it's this and that. Basically, it's not being used, and that's generally the gist that I say or I hear. And what follows that is, it hurts too much. I don't want to do it. So here we go. We're going to go through why does it hurt? Should it hurt? Are you doing something bad? Are you damaging anything? Most people think they're going to damage some things when they're foam rolling. And while you do need to pay attention to pain, it's not something, I'm not a no pain, no gain person. You do need to actually listen to pain, especially if it's not being supervised. Sometimes I will tell you it's okay and you need to suck it up, but if you're out there on your own and you're not sure and you're questioning and something hurts, don't push through it. Not worth it. You wind yourself up in a lot of trouble. So if it does hurt, you need to stop, but generally foam rolling is going to hurt, and that's okay. Just make sure that you are understanding why it hurts, and if you are really concerned about it, you get some professional help. We can help you out here. We offer free consultations. All you have to do is call our office at 215-997-9898, or you just click the link in the box below, and it'll take you right to a page where you can fill it out. However, if you're still doing this at home, I'm going to take you through a couple moves. I'm going to show you some things, but why it hurts. We're going to go through why it hurts. So most of the time, you're not going to start off with one of these. So what we do in our clinic is we have a lot of spike foam rollers called rumble rollers. They are the most aggressive foam roller. I know there's people out there that roll with PVC pipe. There's people out there that roll with all different types of things. What you want to make sure is, I generally recommend having two foam rollers. You want a flat one and you want a spike one. Because there are some days that you're going to get on a spike one or a grooved one or an aggressive one, and it's going to hurt and you're not going to be able to do it. And that's okay. That's why you have a flat one. You want to make sure you do it every day. So what is hurting when you're rolling? So a lot of times what happens is, I'm going to turn my foam roller this way. So a lot of times if you just do this, and you don't have any severe back pain, you're not going to feel anything. You're not going to feel any trigger points. You're not going to feel any knots. If you cross your ankle over your knee, it's going to move to, maybe you'll find a spot that hurts. And this is where people start to back off because it doesn't feel pleasant. And this is what we call foam rolling or piriformis. And it can get a little bit painful. The most painful one, hands down across the board, unless you're injured, is the IT band, where you're on your side. So get a lot of people backing away and shying down from doing that one. Now, why does it hurt? So what happens is there are knots in your muscle, okay? That's a very scientific term. The knots that are in your muscle are literally what you're feeling when these knobs or that foam roller goes into your leg. You're feeling those knots, and what you need to do is you actually need to break those up. So if you have pain and you're rolling across a muscle and you're like, oh my gosh, I can't tolerate this, it's actually a sign you need to do it more. There's a lot of problems if you stop, and it's going to create a lot more problems if you don't get those knots out. So when you're rolling and it hurts, that's just a knot that's in your muscle that needs to come out. Now, if you are just getting into foam rolling, you are not going to be able to do this for very long. You don't want to sit there on a muscle for 10 or 15 or 20 minutes. You don't want to aggravate a muscle to the point of having it hurt to, not being able to walk. Bruising is kind of a part of it. Yes, you can wind up with bruises, especially if you're doing spike. But when you do something like the IT band, I'm going to show you here. So we're rolling like this, all the way up and down the IT band. Okay? When you're rolling this, you're going to find, and it's your first time, you're going to find 100 spots in there that are going to be extremely painful. You don't want to stop on each one and dig it out because you know it's a knot and it needs to come out. Pick 3 or 4 and then find 3 or 4 the next day. When you're digging out a knot, so to speak, or you're foam rolling a knot I kind of like to compare to an onion. It's got layers. So you may slough off a few layers as you're foam rolling, and then you might put them back on as you go run, but each time you foam roll, you want those layers to get a little bit less. Now, if you foam roll to the point of just aggravating it, those layers are going to come on a lot more quick because you're going to have aggravated the muscle. So you're going to be limping, you're going to be using the muscle improperly, it's going to knot up even quicker. So while it's okay that it hurts, and it's going to hurt that first couple times, and maybe a month, maybe even a couple months, it eventually will feel much better. But don't needle the heck out of it. Don't sit there and just be like, I gotta get this knot out. 15 seconds, 20 seconds on a knot, and that's it. All right? There are different ways that you can take the body weight off of the foam roller, as I was showing you when you're doing the IT band. You can use your hands, you can do the leg in front, and you can have very little weight pushing down on that leg. Okay? You can have all your weight and just kind of let it all go. Most people, when they start off, report getting an arm workout and an ab workout because of using their arms and abs to keep their body up off the foam roller. That's okay. Push up with this leg, push up with this arm. If you're on your back and you're doing your piriformis, push up with your leg. Don't let your butt sit down as much if it's really painful. You can minimize the pain. Don't avoid it. Don't not do the exercise. Don't push up so much that you can't even feel the foam roller. You're not doing anything at that point. You're not doing what you're designed to do or what it's designed to do. So when it hurts, it just means there's a knot. And what I teach people is most of the time, if you do this regularly, and this should be something that's part of your everyday life all the time. It's better than stretching, and it's easier to do than stretching because you can just do a couple minutes here or there and throughout the day. But once you get really good and once you have spike, you'll be able to feel problems before you ever feel pain. So if you're on this and you're rolling and you feel tightness in your calf, or you roll over a knot and you're like, oh my gosh, that's a sign of something that's going to come that's not good. So if you get it out and you correct it, you're going to be fine. So it is a very good almost detection tool once you're able to foam roll in a more of a management, okay? More of, oh my gosh, it actually feels good. But in the beginning, it doesn't feel good. It hurts. It's supposed to hurt. You may wind up with bruising. But again, don't go past that point of comfort. Consult somebody. Call our office and get a free consultation, 215-997-9898. Come in and talk to somebody. But it's going to hurt as you break up the knots. That is not a reason to put it in the closet. We are sitting more these days than we ever have. It's super important to get on a foam roller and break up all of that muscle tissue that's knotting up. The more we sit, the more knots we get. You really want to make sure that you're breaking all of it up, that you're helping that muscle, but you're bringing blood flow to the area, which a foam roller will do. So it hurts because there's a lot of knots in your muscle. You can mitigate those, you can minimize those by pushing up off your hands and your feet in order to help reduce some of the pressure going down on that muscle, reduce some of the pressure going down on that knot, but you shouldn't stop. You want to do about a 10-minute foam rolling routine all together, all in at the end of the day. Should touch every part of your body. That doesn't leave a lot of time for you to spend on something that can be really sore, like a calf, like a hamstring. If your calves are sore, your hamstrings are sore, you can do one at a time. You can sit here and do this and just roll it back and forth, especially if you have spike. Right off the bat, spike sometimes does not feel good. All right, so you're not going to be able to push up and then cross over. There's very aggressive ways out there on the internet that are shown on how to foam roll. If you try and start there, it's going to fail. It's going to be so painful you cannot tolerate it. You shouldn't be at that point. It should never be to the point that it's so painful you can't tolerate it. You gotta modify, you gotta push your butt up, you gotta use your hand, you gotta roll, you gotta use one leg. Whatever it may be, there's a modification there that can help reduce some of the pain. Again, you're going to have to get through some of it. It is going to be painful right off the bat, but you will eventually get to a maintenance point where you're like, oh, this just feels good. I just did a quick roll, feels great, no pain, no problem. I know if you're first starting out, you're like, there is no chance this will ever not hurt. And I get this question all the time, like, are you serious? I'm going to do this one day and it's not going to hurt? Yes, okay? Usually, when you're in my office, you're here for reasons and you have some pain going on. So, but I promise that if you do this consistently every day, you get to the point where those knots are gone. Ignoring them doesn't make them go away. Stretching them doesn't make them go away. This makes them go away. If you don't get them out, if you don't treat them, they will become an issue. They will become a problem. They will begin to affect not only your leg, not only your piriformis, not only the back of your leg, but they'll go down into your feet, into your buttocks, they'll go up into your arm, wherever it is. So you'll start to feel more global pain if you don't address the knots. So it hurts, it's knots, you gotta get them out. If you want a free consultation with one of our doctors of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.